You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I am sitting down with Tim Kelley, who is the CEO of TeleRay. Tim, welcome to the show.
Thanks for having me, Dr. Roxy.
It's nice to have you here today. So as always, I like to start off with giving our listeners and our viewers a little bit of context. So share with us what you've been innovating these days and a little bit about your background.
Well, my background's always been healthcare, from pharmacy benefit management in the days where no one ever heard of it. So getting people to use prescription cards back in the day, and then going into a variety of different things, human pharmaceuticals, dermatology, veterinary distribution, and then eventually led me to radiology, being part of a group where we're trying to figure out why CDs and DVDs and VHS tapes were being sold to hospitals in the late 90s, and found out that DVDs were being used to replace cine film in cardiology. And then we thought, geez, maybe we could start replacing film in radiology with CDs. And so my partner and I at the time, we started pushing CDs into radiology, and everyone thought we were pretty much idiots for even attempting that, because PACS systems were just getting going and doctors loved their film, and the term wet read is still used today for slapping that wet film up in a light box. So even though it's not wet anymore, but so then as things progress, it was about capability that then moved into solving real workflow problems and efficiency and moving data from A to B and solving those problems. As we've always said in the past 20 some years, that it's one thing to move something from A to B, but if you can't use it, you didn't solve anything.
What I think is so interesting and enlightening about what you're saying here is that you're talking about problems, and you're leading the conversation with the problems that customers are facing, and then coming up with solutions to address those. And although that seems like, well, duh, like that's how every business really should start. Too often we start off with solutions. We start off with the technology that we're really excited to build, and kind of try to find a problem to match it to. So I just want to point that out for our viewers and listeners, to just kind of heed this, that it's really important to start off with a problem and then figure out the solution.
Yeah, in any business I've been in, it's always, let's start with the problem and then work with the customer to find a solution and build it together. And that's always been the process. Great.
So where are you in the innovation process now? When did TeleRay start? How long have you been at this?
Well, I've been in radiology, DICOM distribution or image management for a long time. And that's just, getting images to patients, to referring physicians, to specialists, and making sure it's usable. And then we decided to go down the path of telehealth a while back, because I'm not sure exactly what the number is, but in face-to-face consultations in telehealth, 70% of the time it involves some type of radiology procedure that's been done or that's going to be done, because that's the primary tool for diagnosis.
Sure.
And so looking at that, there was no combined tool out there. And last year, oddly enough, when COVID was really getting going, there was this ad out by Microsoft Teams with a doctor talking about sharing images through Teams with patients and specialists, although he doesn't show it in the ad, and they don't explain why. And part of that is because Microsoft doesn't actually have the protocols DICOM and HL7 in healthcare to pull that data and display it on the screen. They can do screen sharing just like you can do in Zoom and other platforms. Mm-hmm. But do you have the true network connectivity to say, let's say you and I are talking and they say, I want to bring up your shoulder x-ray, and then walk you through it for patient consent, education, maybe higher compliance and how you treat yourself in the coming weeks. Those are all very important tools to use, and they just don't have the connectivity. So that's what we've been building, is making sure that for having one of these calls, that I can pull that data up on the screen, whether it's a report, whether it's your images, pathology, and then have a more engaging conversation.
So one of the things I I noted is that you talk about how like telehealth and X-ray have been around for 130 years.
Right.
So what's happening in the market, in the landscape, market trends that makes it more ripe now for what you have to offer, for that to be valuable versus something that's been around for quite some time?
Yeah, it's really funny because when we say that line, people kind of laugh. That's not true. And then you say, well, actually, one of the very first phone calls had to do with checking up on somebody and their condition. So that was the first telehealth call. And so then if you look at radiology, of course, that's been over 100 years now. And no one's really put the two together. I'm sure there's been phone calls, but what I'm talking about is on-screen imaging and sharing and collaboration. And so we combine these platforms and this capability. And oddly enough, we started working on that right before COVID. And then COVID hit, and it was a strange blessing because it pushed this innovation into the forefront. And
Sure.
it just becomes a much more useful tool. If you look at the real definition of innovation, they always say it's when invention becomes useful. But it's not just when it becomes useful, it's also, is it being used? Is it practical? And so this really made it practical because telehealth was about making sure there wasn't cross-contamination, keeping sick patients at home, keeping healthy patients at home. And so if you can have these collaborative consultations with imaging reports and so forth, you're probably going to eliminate at least 50%, if not more, of on-site visits. And that's going to be part of the new normal going forward.
Sure. Yeah. Well, I also want to pause because I think that's a really important statement. If you don't mind just repeating it on how you define innovation.
Sure. So it's when invention is useful. That's usually how most people describe it. But yeah, it's one thing to be useful, but is it being used and is it practical? And to elaborate on that a little bit more, the practical part of it is there's a lot of innovation out there that's very technically advanced and could be very powerful, but it's not user friendly.
Mm-hmm.
One of the things we do as we're building out any type of process is that we like to say, let's keep the complexity behind the curtain. Let's
Sure.
not have the user experience anything complex at all. So they can do really complex processes, but not actually know that they did that. So
Like Amazon, when you order something and it's at your door in 4 hours.
exactly, we use them as some of their examples as well, and Apple and
Yep.
even copy machines. We say, how can someone walk into a Kinko's, do a 26-page catalog in color with a hard binder that's saddle stitched, and they've never used this machine before? Because they
Right.
have little macros that walk people through the next logical step in the process, basically asking you questions, what are you doing next? And we've done that with our software as well.
So that's really great. I think that the idea of innovation being useful or interventions being useful is just something, it's another point to just really kind of like pause and talk about, because there are so many innovations out there, or inventions, I should say, out there that aren't useful or are useful, could be useful, but no one's using them. And it could be for some of the reasons that you described. And, what I found often too is that, a lot of times there's no market need, going back to what you were saying, with starting with a problem instead of starting with the technology.
Yeah, yeah. Well, yeah, and then as part of that, can the user then adapt to it? Can they use it? And so another thing we always say is if we had to create a 200-page manual, we failed in our design. So someone, just like that copier antidote, you should be able to walk up to it and use it. If you're in healthcare, you would understand, okay, I'm going to import an image, I'm going to send an image, I'm going to start a telehealth call here and bring someone up face to face. So simple.
I'm laughing because it makes me think of a client that asked us not too long ago to create an explainer video for a 2-click process. And I said, if we need an explainer video for a 2-click process, something is wrong with that process. Like something's wrong with the user experience if we need to explain 2 clicks.
That's true.
oh, oh, man. Just share with us your footprint now. How many customers do you have? Kind of give us an indicator of like where you are as far as penetrating the market.
We're in, geez, it's over 3,000 users, 1,000 institutions, and over 70% of the top 50 medical centers. Most recently, we're just finalizing deals with Duke and Baylor, which is great.
Congrats.
Yeah, and they see what we're doing and they say, okay, this is going to solve a lot of our problems through our entire network. And some of it is they look at it and say, okay, we can use some of the tools within your platform, which we're always grateful even for that, because we know that it's going to save them time, money, but more importantly, ultimately it saves lives. And there's a lot of status quo mentality out there that sometimes this crap just doesn't work. So we're going to rescan patients. We're going to have them come back, expose them to more radiation. And that's just in our world unacceptable.
Mm-hmm. Sure. So a lot of people that I talk to that are maybe even in this business, in their businesses much longer, have not acquired that many customers or that many of the top medical practices. So what's the secret, or what are some of your commercialization strategies as you kind of look back at maybe some of the actions over the last couple of years? What were some of those strategies or tactics that you deployed that you think help you get to where you are today? Because it's a really big milestone with the long sales cycles and some of the most difficult to get in front of customer segments in healthcare.
That is a great question and a multi-tiered problem. So we look at every point of contact as being valuable first. And so whether it's an hourly rad tech, up to the CEO of the hospital, as far as we're concerned, they're all stakeholders in what we're trying to accomplish. And when I say what we're trying to accomplish is looking at what is our mission. And so the mission is to create a global healthcare communication tool that solves a lot of these problems in moving data, sharing data, empowering patients. And then thirdly would be adhering to what we call our first principles. And for us, it's about growing the network. That's got to be the first thing. Because if we do that, we have then achieved the mission. And in that process, though, to acquire customers, we've sacrificed revenue. We've worked with customers to add features that say, okay, they might say, we have this specific communication problem with this OEM. Can you solve that? And we solve that. Because OEMs try to control the market in many ways. Mm-hmm. So they want to be a GE site, a Siemens site, a Philips site. And so they do little things to try to control that. And there's a whole bunch of technical answers for how they do that. But ultimately, I think that's what it's about, is controlling it. Say, well, if you just bought another GE system, it would work perfect. And so we help those systems work better and communicate. So yeah, ultimately it's about going to that customer and diagnosing their problems and saying, how can we solve this for you? And then adapting to it. And that's another thing that we say all the time. It's adaptation is more important than adoption.
What do you mean by that?
Well, because I think adoption is kind of an abused word in tech that, oh, we just need adopters and adopters. Well, if you're solving a real problem, then they're just going to adapt to it. And so when they see a new tool, for example, we may talk to let's say an interventional radiologist, say, well, this is great, you can move the data, but I would never use the telehealth feature. And it's built into the platform. So it's always going to be right there at their fingertips anyhow. Then we'll talk to them 2 months later. Yeah, now I'm communicating with my patients. That telehealth tool is great because the images are right there. And so that's an example of they didn't adopt our technology, they adapted to it.
Okay, that makes sense. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So when you use the terminology of customers versus growing your network, what's that distinction?
Well, because if someone uses it once, they could be a customer, or in our network, patients get the tool for free. So any patient at any facility, whether it's a small single practitioner's doctor's office up to the largest institutions, patients can store and manage their data and have free telehealth consultations with whoever they're trying to connect to. And that can even be a family member. It doesn't matter to us as long as they're part of the network. And so, and then when you're looking at growing the network, it's a little bit different principle that we have to have that registered facility as part of the network. And then they are serving those customers, whether it's clinician to clinician or to a patient or connecting to that local hospital as the hub.
So would you say that you have like part of your business model is a freemium model?
It is for the patients, yeah.
Mm-hmm.
And then if it's let's say we have a unique case where let's say we haven't dealt with something before, a specific type of modality or a specialist that has a certain problem, we may say, okay, why don't you use it for free for the year and then give us feedback on what you need to make this better, those types of things. And generally, they're more than willing to do that. And if we solve their problem, they're going to end up telling their friends. So that's always good.
So would you consider that a pilot? Are those official pilot engagements or unofficial pilots?
Yeah, we call them luminaries. So, and they love that term, that they're a luminary. And it's basically like that, a pilot, and give us the proper feedback.
So how is the patient freemium model impacting growth, or is it?
It's getting there because you have to have a huge amount of patients to end up having influence on the healthcare community.
Sure.
And so we're going to be pushing more and more of the messaging out, whether it's through Facebook and other methods of reaching patients, saying this is a way to manage your healthcare data for free. And that'll end up driving the enterprise at a certain point. Mm-hmm. So we certainly have thousands of patients registered and using the platform, but that critical mass number is a mystery. It might be 1 million, it might be 5 million. We don't know where that's at yet, but we're going to start pushing that more. As we always look at the, when people talk about patient empowerment, the one thing we always notice they leave out of the process is the patient. So we're trying to really get them involved.
That's one of my soapboxes, Tim. Yes.
I'm glad you feel the same way.
Yeah. I mean, there's so many different stakeholders in the healthcare system, and it's interesting that they say we all like to say, well, we're patient centric. And it's like, okay, well, how are patients involved in the development of these tools? The term that I use is co-creation. Are you co-creating with patients? No, but we're patient centric. Well, how? Because we put that in our story.
Yeah, it's really crazy. I mean, some of the stuff that we see out there. One is with one of our technologies where we can connect directly to modalities. So there's different types of rural outreach programs. And so let's say you're a maternal fetal medicine specialist. Normally, they drive out to these rural areas to have that one day of scans or seeing those patients, or the patient has to drive in to get scanned. Mm-hmm. So, but if you could virtually put a specialist standing over the shoulder of a sonographer or technologist and review that in real time with face-to-face consultation, That solves tremendous problems, and that's true patient efficiency and helping the patient, preventing false positives, false negatives. Much more efficient for specialists because there's fewer and fewer of them these days. So how do they become more efficient? And then those patients can make decisions on what their next step of care is without sacrificing a day of work. Or they can also, through our platform, say, you know what, I need to talk to my mom and she's in California and I'm in Pennsylvania. Bring them right into the conversation, right on the screen, viewing the
Wow.
images at the same time.
Mm-hmm. Okay. So, what are some of the, as you've involved patients in this process and you've engaged with them more, what are some of the things that you've learned and how they might have impacted the business going forward?
That they like to have that level of control. It's the one thing that patients are starting to understand more and more of, whether it's through Dr. Google or one of these other tools out there, is that they do have some rights that they didn't understand in the past.
Yeah.
Even acquiring their images, if they request it from a facility, the facility has to give them the complete study, and that's true of any healthcare information, whether it's pathology, cytology reports. They can get all the information and then manage it themselves, where they can say, I want to get a second opinion. Um, and you can't blame healthcare facilities for wanting to control their patient population, keep them ring fenced, because that's how they make a living. But
Sure.
patient freedom comes with having complete access and control of their information.
Hmm. Yeah. And we're definitely seeing that right across the country. I think that COVID certainly has been a catalyst for that, even more so. And we're just going to see that consumerization just continue to grow and expand over
Yeah,
time. Yeah.
yeah, it's definitely become consumer driven.
So when you think about like what's next for you, what are some of the specific challenges that you are working to resolve right now?
I'd say access to what we call the massively underserved market. So when you look at, there's something like 700,000 doctors' offices in the US, and about 500,000 of those have some type of acquisition device now. So whether it's a digital x-ray, a portable ultrasound, and then if you look at some orthopedic offices, they have their own MRIs, limb MRIs, CTs, and so forth. And are they managing their data properly and giving access to patients and connecting to the hub, preventing unnecessary duplicate rescans, being more efficient? So we look at is that we're in a lot of institutions. Now, if we could get to the supporting healthcare community, which is where we are growing now,
Mhm.
is
Mhm.
that we connect them all together and we're going to solve a tremendous amount of problems. It's a bullet list that's 50 bullets long, and so that's what we're trying to get to. And we hear about doctors who say, "Well, I'm compliant. I just put all my images on a USB drive that's 2 terabytes. And I keep it in my car at night, so it's safe." We literally just heard that earlier this week, and we said, "No, no, no, you can't. That's not compliant. You can't do that." And
Mhm.
because there's certain rules on how you're supposed to be managing that, whether 7 years to 21 years, depending on what your specialty is, you have to.
Sure.
Yeah, and it's kind of scary that that's still going on, but we're going to solve it.
We don't have to name any names.
No, no, we don't do that.
Right, right, yeah. So what is McAfee's law and how is that playing a role in your business and your growth strategy?
So so we're a peer-to-peer network, which is a type of infrastructure and how you manage and communicate data. So it's much faster, much more secure. But what happens is when it's endpoint to endpoint connection, and you start to build more and more connections, you create a true communication network then. So going back years ago, when they used to talk about the value of Facebook, I didn't really understand why it was valuable. And then
Mm-hmm.
you start to realize with that effect, you put out one message because of the endpoint to endpoint connections between all those users, even if they're passive users. One post could reach a million people in a matter of moments. And so having that, we kind of reverse the model. And this is, some people call us the PayPal of healthcare.
Uh-huh.
So, because anyone can register into the network, so that the hospital doesn't control all the credentialing. So whether you're a patient or a doctor, you can become part of the network. And just like with PayPal, share money with anybody within that network securely. You can share and communicate with anybody within our network securely.
Okay.
And so that's kind of reversing the model, although we do have it where hospitals can control that as well.
Mm-hmm.
But yeah, anyone, they could sign up today and say, okay, I need to communicate with somebody across the country.
Um, so, what is your growth strategy going forward as you think about being able to penetrate the market, increase adoption or adaption? Is what are some of the strategies that are leading you to success that you want to maybe share with the audience here, so that they might be able to learn from some of the successes that you're having?
Um, having the having your stakeholders and your constituents, so especially our clinical users, connecting to their friends in the business.
Mm-hmm.
So specialists that may be dealing with a GP on a daily basis. But as soon as they make those connections, that grows our network. And so we actually ask them to do that, or we ask them, could you give us a list of names? And our salespeople will call them
Hmm.
and then say, hey, Dr. Smith just put in our system, this is why, this is how it works. And you can communicate now and share data in seconds if you're connected and registered into our system as well. One of the big pushbacks is just registering to the system, which I always find kind of funny because people do this every day, registering into websites and so forth. And yet to have some of that resistance that we always find funny,
Sure.
although it's a one-time process. And so once they do get over that hurdle, then they're in the network and then they love it after that. But that is one of the barriers, oddly enough, is to do the mission sale and say, you need to be a part of this network.
So, I think word of mouth marketing is such a key component of success for any early stage company being able to cross that chasm, right? So you uniquely kind of have a platform that helps to facilitate that peer to peer collaboration or engagement. How has word of mouth maybe even influenced like the customer advocacy? Is that something that's happened more organically, or is that something that you've even helped facilitate? So you gave us one example, but I'm thinking maybe more even on a broader scale.
Yeah, we definitely have to help facilitate it.
Mm-hmm.
Um, and then there's a bit of a competitive nature too in there, where they want to be at parity of their peers, or you have someone who doesn't want to tell somebody else about it because they want to have that advantage. So, and trying to navigate that. But the one thing we use a lot is the credibility factor or halo effect that, hey, if it's good enough for Cleveland Clinic or Cedar Sinai, then you should be okay with it too. And so we do push that a lot. And generally, if we're going down that list of who uses our software, they do kind of say, okay, that's enough. You can stop now. I get it.
I get it. I'm the only one that's not doing it yet.
Yeah. And so, and what it means, it's obviously it has that halo effect, but also that it passes some muster because they know that it's been through that security process, that's always number one on the list. Are you going to pass our security tests? And so if it already did at these other sites, then it probably will there too.
Mm-hmm. Do you think that helps move the sales cycle faster?
I think it does, and it's just having all those things prepared in advance too. So, how
Mm-hmm.
does your network work? All your certifications for security, and there's such a long list of them. SOC 2, SOC 3, High Trust, Coral, MDS 2. I mean, it seems endless. NIST, VSA. I mean, it keeps going on and on. And so we have those always organized in a folder, and we can just send them a link and say,
Yeah.
here's everything, just to show that we've been through that process.
Mm-hmm. Well, that's wonderful. So, as we kind of just start to wrap up here, is there anything else that, a bulk of the audience for this show, if people just like yourself that are in different phases of the commercialization process, is there any other lessons learned or any insights that you would want to share with anyone?
Geez, good question. Every week we do a meeting where try to get everyone involved in discussing every topic. It's basically stealing it from Ray Dalio, with his the transparency thing, but also you never know who's going to come up with a good idea in your group. So people bring all different kinds of backgrounds and ideas, regardless of what the problem is, whether it's technical or financial or whatever it may be. And we'll have a list of things we're trying to solve. So it could be a compliance issue, relationship issue with a site. So these can be very broad, and someone might say, "Hey, did you think about this?" And so anyone can say anything. There's no dumb questions, just dumb answers. So.
So creating a culture of, I guess, transparency and candidness and kind of community that you're feeding off of each other.
Yeah, include everyone, and then they're more excited to come to the meeting then too. So
sure.
Instead of, oh no, it's another meeting, it's like, hey, it's another meeting. I might be able to contribute here.
Sure. Excellent. So how can folks get a hold of you if anybody wants to follow up more about TeleRay or just getting in touch with you going forward?
Well, I do have one of the most simple emails out there, just tim@teleray.com. So very, very easy. That's the best way to reach me. There's also info@teleray if it's more general, but and then teleray.com, the website, there's more contact information there too.
Awesome. Well, thanks so much for joining me today, Tim. It's been great.
Yeah, thanks, Dr. Rexy. Really appreciate it.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.